Hi, this is Dr. Chan here at Dentistry. We've been getting a lot of questions about gums and what makes them healthy or unhealthy. Today we're going to try and answer some of those questions, so hopefully you have a better understanding of what constitutes healthy gums. So gums are really important because I like to think of them as the foundation of a house. If you can imagine that your teeth are a house that you're trying to keep in as good of a condition as possible, your gums and basically the underlying jawbone are the foundations of that house. It doesn't really matter if you have this big, beautiful house if the foundation underneath it isn't strong, because if the foundation's not strong, then that big, beautiful house will collapse or deteriorate. This is kind of how the relationship is between our gums and our teeth. We want to make sure the foundation, which is your gums, is strong so that your teeth can be happy and healthy. So one of the first things that we look at to see if your gums are healthy or unhealthy are, how do they look? Healthy gums should be the right color, meaning pink, not too red, but also not too light colored either. We want them to have the proper color. We also want them to have the proper shape. We don't want gums to be puffy or kind of soft feeling when we push on them or take a look at them. They should be firm. And also, like I said, there shouldn't be any bleeding, even when we touch them, likely with our instruments. Healthy gums should not bleed. They should just slightly rebound to our touch and then come back to the original position that they were at. So there are a couple of major things that can make gums unhealthy. One of the first things is the accumulation of bacteria. So our mouths are filled with bacteria just from things going in and out of our mouth, just the natural bacteria that occurs in our body. A lot of these bacteria that are in our mouth are not healthy. Bacteria is what causes cavities. Bacteria is also what causes gum disease and makes your gums unhealthy. So if too much bacteria accumulates around your gums, they can become unhealthy. Another thing that can affect the health of the gums is our diet. If we eat certain foods, especially ones that are higher in sugar or higher in acid, those things can deteriorate your gums more quickly and make them unhealthy as well. One of the final things is just medical conditions. Something that can add to the deterioration of your gums is certain medical conditions, especially ones that increase the acidity levels in your mouth. For example, a lot of times people have nowadays reflux, which means that due to a medical condition or due to their diet, they have a lot of acid from their stomach that will come up through your throat and through your esophagus and into your mouth. That can also add to the unhealthiness of your gums. So thankfully, if people have unhealthy gums, most of the time, this is reversible. Or at least we can get a patient with unhealthy gums to have healthy gums. One of the first things is that we need to make sure that oral hygiene is good. We want to make sure that you are brushing and flossing and seeing the dentist on a regular basis. That's important because we want to make sure that all of that bacteria, that food, all the stuff that's in your mouth doesn't accumulate around your gums and cause problems for them. Another thing is to make sure that your diet is right. We want to make sure that you're eating healthy, not too much sugar, not too much acid. All of these things can play a part in how healthy are your gums. Sometimes when an infection is present in your gums, we need to go in there and basically get it out. We need to clean things up so that things are healthy again. So one of the ways that we do that is we go and get your teeth numb. We put the gums and the tooth wherever the gum disease is present. We put that to sleep using local anesthesia. After the area is sleeping and you're comfortable, we basically go underneath with our instruments and clean out whatever infection's there. The aim and the goal is that once the infection's cleaned up, then hopefully your gums will be healthy again. Sometimes if a person's gums are very unhealthy or if there's a good amount of gum infection, sometimes the procedure or the treatment may take more than one appointment. Sometimes gum infections are located in various areas of your mouth. So we usually don't clean an entire mouth one sitting if there's gum disease present. So usually we'll break it up either into 2 or 3 appointments and just try to tackle one portion of the mouth at a time. When there's gum disease present, usually it's underneath the gums, and generally those areas tend to be pretty sensitive. So as a result, before we go in there and try to clean things out and remove the infection, we usually put the area to sleep with either local or topical anesthesia so that you're comfortable while we're working on you. So after a deep cleaning has been done in order to remove deep-seated infection in your gums, usually the gums will be a little tender, so you usually also be numb from the anesthesia. So we always tell people to be careful when eating, drinking, and talking. But in order to take care of the area that's been treated, we tell people usually rinse with warm salt water or mouthwash. Sometimes we'll prescribe an antibacterial mouthwash such as chlorhexidine, but we also tell people to be regular about their brushing and flossing, but to do so in a gentle manner so you don't continue to traumatize the tissue that's been treated. Sometimes when gum disease is present in a patient's mouth for a long period of time, it's possible that a person can lose a lot of their bone support and gum support around the teeth. In those cases, you'll see that because the tooth root will be exposed and a lot more of the tooth will be visible than you had previously been able to see. If enough bone and gum deteriorates away from the tooth, sometimes a gum graft is needed. What that means is that we'll take a portion of your gums, usually from another part in your mouth, and basically attach it or sew it to the portion of the tooth and the gums that has been deteriorated. Oftentimes, this will be done by a gum surgeon. We generally don't tend to do those procedures in our office, but we work closely with other surgeons to accomplish that. So if you feel like you have gum disease or you have some problems with your gums, please don't hesitate to call our office. We have our front desk personnel that are trained and ready to assist you in any way that you need. They can make an appointment for you, usually the same day that you call. I hope this has been helpful in teaching you a little bit more about your gums. If you have any more questions or if you're ready to take action, please call our office at 916-285-9678. We're here to help. Thank you.